Assalamualaikum. Welcome to Pharmacology Notes. Today we are going to discuss about calcium channel blockers. Calcium channel blockers, commonly referred to as CCBs, are class of medication used primarily to treat various cardiovascular conditions. They work by blocking calcium ions from entering certain cells, including those in the heart and myocardium and blood vessels. By inhibiting calcium influx, calcium channel blockers help relax and widen blood vessels, thereby reduce heart rate and lower the blood pressure. This class of drug is commonly prescribed for conditions such as hypertension, high blood pressure, angina, chest pain, and certain heart rhythm problems. Certain types of the calcium channel blockers are there. The most common examples are the number one dihydropyridines, DHPs. Example are amlodipine, nifedipine, and felodipine. They are selective for vascular smooth muscle and primarily used for hypertension and angina. They have minimal direct effect on the heart and mainly causing vasodilation. The second class is non-dihydropyridines, non-DHPs. Example include verapamil and diltiazem, and they have significant effect on both vascular smooth muscle and the heart. Used for hypertension, angina, cardiac arrhythmias, and depressant effect. Okay. Now we have mechanism of action. As far as mechanism of action of calcium channel blockers concerned, let's discuss about various type of the receptors or channels. Calcium channels come in different types: L, T, P over Q, N, and R type. These types are based on their kinetics and receptor specificity. L-type calcium channels are found in various tissues such as heart, skeletal muscles, neuron, vascular smooth muscles, and uterus. They play a role in the muscle contraction. Okay. So calcium channel blockers are the medication that work by blocking L-type of the calcium channels. I hope it makes sense. By blocking the influx of the calcium channel through these channels, like L channels, calcium channel blockers inhibit the contraction of the smooth muscles. Okay. Among calcium channel blockers, there are two main types as I discussed earlier: dihydropyridines, DHPs. And the other class is non-dihydropyridines, non-DHPs. Dihydropyridine calcium channel blocker have a higher selectivity. Okay, higher selectivity for the blood vessels. These calcium channel blockers have little effect on the recovery of the calcium channel that is present in the heart, which is important for the heart rate, conduction, speed, and refractory periods. Important for the AV node. Just for information, I am representing here. As a result, dihydropyridine calcium channel blockers are primarily cause vasodilation, like a widening of the blood vessels, and have minimal direct effect on heart. I hope it makes sense and it's clear what are DHPs and what are non-DHPs. While on the other hand, the non-DHPs calcium channel blockers such as diltiazem and verapamil exhibit significant effect on the cardiac tissue. Okay, they not only block calcium channels in the blood vessels, but also affect calcium channels in the myocardium or heart. By doing so, non-DHPs are reduce the influx of the calcium ion in the cardiac cells, leading to the several effects. The first effect is the negative inotropic effect. Non-DHPs calcium channel blocker decreases the contractility of the heart muscles. This effect reduces the force with which the heart contracts, thereby decreasing the workload on the heart. I hope it makes sense. Chronotropic effect, and let me explain this first. These calcium channel blockers also slow down the heart rate by inhibiting the electrical conduction system responsible for generating and spreading the electrical impulses in the heart. So this is about negative chronotropic effect, inotropic and negative chronotropic effect. I hope now it's clear to you people. Now let's discuss about clinical effect of the calcium channel blockers. The number one is the hypertension management. Calcium channel blockers are effective in lowering blood pressure. Dihydropyridines, calcium channel blockers primarily dilate arterioles, reducing peripheral resistance, and non-dihydropyridines have negative effect, chronotropic and negative inotropic effect, reducing the cardiac contractility. Angina treatment. Now, angina treatment, calcium channel blockers decreases myocardial oxygen demand by dilating the coronary arteries. They increases myocardial perfusion and can be used as first-line therapy or a combination with anti-anginal medications. Cardiac arrhythmia management, non-dihydropyridine calcium channel blockers such as verapamil and diltiazem are used to control certain types of the cardiac arrhythmias. They inhibit the conduction of the electrical impulses and slows the heart rate. Raynaud's phenomena, calcium channel blockers, especially DHPs, are used to manage vasopatric disorder like Raynaud phenomena. This helps dilate peripheral blood vessels and improve blood flow. Migraine prophylaxis. Some calcium channel blockers, such as verapamil, have shown efficacy in preventing migraine attacks. They help reduce the frequency and severity of the migraine, possibly by modulating cerebral blood flow. Now let's discuss about pharmacokinetic properties of the commonly used calcium channel blockers. This is all about calcium channel blockers, amlodipine, nifedipine, and all that, with absorption, protein binding, metabolism, elimination, and half-life. Side effects of calcium channel blockers. Low blood pressure. Obviously, calcium channel blockers can cause a decrease in blood pressure, leading to the symptoms such as dizziness, lightheadedness, fainting. This effect is more pronounced when standing up or changing position quickly. Edema. Calcium channel blockers may cause fluid retention, resulting in the swelling in the ankles, feet, and legs. This side effect is more common in long-term use and may require dose adjustment or additional medications. Constipation, headache, flushing, or certain other side effects. Contraindication of calcium channel blockers. In heart condition, calcium channel blockers may be contraindicated in individuals with certain heart conditions, such as severe heart failure or certain type of the heart block. This is because these medication can affect the heart electrical conduction system, so these are contraindicated. Low blood pressure. Individual with low blood pressure may need to exercise caution when using calcium channel blockers because these drugs lower the blood pressure. Okay, I hope it makes sense. Liver dysfunction. The calcium channel blockers are primarily metabolized in the liver, so individuals with significant liver dysfunction may require dose adjustment or alternative treatment options. Grapefruit juice interaction. Grapefruit juice interaction with certain calcium channel blockers, leading to increased drug level in the blood. It is advisable to avoid consuming grapefruit juices or discuss with a healthcare professional if this is a concern. Hypersensitivity. Individuals with a known hypersensitivity or allergy to calcium channel blockers are advised not to take these drugs. I hope this makes sense. This is all about calcium channel blockers. I hope you people understand it. Please like and subscribe the channel. Allah Hafiz.